You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in non-invasive or minimally invasive facial rejuvenation. With us, we have an expert on the topic, well-known, world-renowned, literally, facial plastic surgeon, Dr. Gregory Keller. Dr. Keller, welcome to the program.
Nice to be here again, Randy.
Now, you know what, now I've had you on the show, I guess almost, 8 years ago was the first time, maybe 9 years ago I had you on the program. But, I say world-renowned, but you really are. I mean, my show airs all over Canada, all over the U.S., and I don't think I ever meet a dermatologist or plastic surgeon that doesn't know who you are. So good for you. Good for you.
Well, thanks, Randy, but we just try and do a good job.
All right, all right. Now, you're in for people that don't know you, you're in Santa Barbara. Tell us a little bit about your background, your training, and kind of how things have evolved where I guess you've been there at the onset of some of this non-invasive or minimally invasive facial rejuvenation.
Well, I'm both in Santa Barbara and L.A. I run the
Okay.
Facial Plastic Surgery Fellowship at UCLA as well. But I've been involved for a long time in minimally and non-invasive work, actually since 1976 when we did some of the first laser work.
Is that right?
Yeah,
Okay.
I've got a textbook on it, actually, that's still in print, believe it or not.
You wrote a textbook on laser.
Laser, yeah.
Is that
yeah.
now? I didn't know that. I thought I knew your whole life story here, but I guess not.
No, actually, one of the interesting things that happened to me was one day someone walked into the office and said, I'd like this laser. And he had a little lesion on his face. And I said, oh, we're happy to do that, no problem. He said, what are you going to use? I said, well, we'll use a laser. And this must have been 24, 25 years ago. And I said to him, yeah, of course we can laser it. He said, what kind of laser are you going to use? And I said, well, we'll use a carbon dioxide laser. And he said, well, that's nice, but how many watts are you going to use? And I told him. And he asked me more questions. What's the
Okay.
spot size? How much energy does it put out? And so forth. I said, you know a lot about lasers, don't you? I said, how do you know so much about lasers? And he said, well, I invented the laser. And that was Ted Maiman, he did.
Is that right?
Yeah, and he became a
Went
good
to
friend.
you as a patient. Okay.
Yeah, he became a good friend for the rest of his life, actually.
Is that right? Is that right? So you've been using it ever since. And so how have things, and we've talked, and this is a big topic because we're talking about non-invasive today, the vampire lift, minimally invasive facial rejuvenation. But you say that really you can get much better results than you could just 10 years ago, 5 years ago.
Yeah, it's amazing, and tracking the progress is like tracking computers, basically. You know, things evolve so much, they do a little bit at a time, but then you turn around and look, and you can get results with non-invasive and minimally invasive stuff that you couldn't even touch 10 or 15 years ago.
And we should define, have a working definition of results. Natural, youthful looking face.
Well, a lot of that's technique, Randy. You'll
Okay,
see people
okay.
who look bloated and all of that who have been loaded up with fillers, or
All right.
you see people who look white who have been over lasered. But for good technique, and a lot of people do good technique, don't get me wrong, you can really get a nice natural look. Now, having said that, the gold standard is still the facelift, without a
Okay.
doubt. And, we've looked at that and looked at some pictures. But today with minimally invasive surgery, we can forestall facelifting, we can maintain somebody who's had a facelift, and we can really make a nice difference if someone isn't ready for a facelift.
Okay, good. Now, one of the photos, and this is a 74-year-old woman, that's a facelift.
That is a facelift. That's a facelift, and you really need that. On the other hand, if after having a facelift, and I think she's at 6 or 8, I don't know exactly the number, years after this, after a facelift, we can work on really maintaining her look with non-invasive or minimally invasive techniques.
Okay, okay. So let's begin then with this vampire lift, okay? Now we talked on the phone about this. It's hot in LA, all over the country, define it. What is it? And is it a gimmick? Is it gimmicky? I mean, it sounds gimmicky to me.
Well, the vampire lift name is gimmicky.
Okay.
And it was taken because you actually take basically a test tube of your own blood, no big deal, and activate that serum that you have so that it releases a lot of the growth factors. And the goal is to trick your own body into making yourself younger.
Okay.
And that really works great.
And you're actually doing that then?
Yes, with that platelet-rich plasma, And the vampire facelift is a combination of techniques. There's a vampire facelift, which involves using hyaluronic acid, often known as Juvederm or Restylane,
Okay.
to help structure the platelet-rich plasma and put it in what's called a scaffold. And that technology's been around for a while. We just didn't use it in aesthetics. We used it in wound healing initially.
Okay. And you like this, and they call it PRP, platelet-rich plasma. It's stem cells?
Well, no, the platelets
Okay.
are cells that first arrive at an area and open up and let growth factors go that make for a little matrix. And into that matrix grow your own collagen and other youthening type of factors.
Okay.
And this stimulates your own stem cells, your own fat cells to grow better and thicken the skin. It also gives nice color to the skin and normalizes the color and makes that more youthening. And the combination of that HA or hyaluronic acid or Restylane or Juvederm along with the platelet-rich plasma is what's called the vampire lift, because that can really lift the cheeks and
Are you
folds.
seeing a lift, by the way?
We are, yeah.
Is that right? So a patient goes in. Okay, so they're watching this. They go in, and where do you get the PRP? I mean, where do you get this platelet-rich plasma? You're using their own blood. I mean, what's that process like? And does it happen right there on the spot?
Well, basically what it is just drawing their blood,
Okay.
and then it's spun down, and then we activate that with a calcium type of solution, inject just a little bit of the Restylane or Juvederm, not enough to form a result.
So, like, where
just
are we
from that
talking?
alone.
Which part of the face are we talking about, by the way?
Well, if we look, the first areas here, the folds, all around the mouth and lips, even the brow, and you know what? It can really help those little wrinkles in the eyes.
Okay, okay.
And then when we combine that with some of the new technology called Smooth Cool, which puts a tremendous amount of energy in cooling, you can really make the skin color, texture, and filling out really great.
Okay, so the technology you're using the PRP. Okay, and we're talking about non-invasive facial rejuvenation or minimally invasive, Smooth Cool, this EndyMed, and the PRP combination. Okay, so the woman goes in, man goes in, 50. Take me through the process, what you're doing, and what somebody possibly can expect. An ideal situation.
Well, that depends on what they have, Randy.
Okay, okay.
If there are wrinkles or sun damage, you may want to do a fractionated carbon dioxide laser, and we use the newest ones of those.
Okay.
In our case, we use a machine called the Equinox, which is about a fourth generation fractionated CO2 laser. And just by then spreading the PRP on, or the platelet-rich plasma.
So you hit them with this fractionated laser first.
Yeah, it's just done under a little topical anesthesia,
Okay.
basically.
Okay.
Yeah. So you do that, and that leaves tiny little microscopic holes in there with normal areas that heal well. But then if you spread the platelet-rich plasma, and there are a couple good peer-reviewed medical articles on this,
Okay.
it'll heal much quicker, but also that platelet-rich plasma will go through those holes and help to rejuvenate
So you
the
just
skin.
rub it on
Yeah.
their face after the fractionated laser. Interesting.
Yeah, and it really makes new blood vessels grow in. It helps stimulate collagen in the skin, and it really helps to change the skin.
I mean, you love this, by the way. We talked on the phone, and I said, because other doctors, by the way, I've had other dermatologists, matter of fact, and say, and I don't know if I told you this, they said, how is Dr. Keller using PRP or platelet-rich plasma? What are his results? And you told me, you said, Randy, in some cases, I don't even have to use fillers, you said, for lines or hollows. You're just using this platelet-rich plasma. Is that correct?
Well, what we do is a vampire lift. We put, really tiny microscopic bits of Juvederm or Restylane or one of those hyaluronic acids just to form a scaffold for the platelet-rich plasma. Then we take the platelet-rich plasma and use it as a filler.
Interesting. Okay.
Yeah.
Okay.
So it fills the skin, thickens the skin, has new blood vessels grow in so the color of the skin gets better, and it rejuvenates the skin.
So your body responds to this platelet-rich plasma by what? Laying down new collagen, What is it doing? I mean, it's a new cellular activity. More. I mean, what is it? What is it?
Well, basically, it activates your skin stem cells.
Okay. Okay.
And that in turn activates the cells called fibroblasts, which secrete the collagen that grows into the mesh that we put down there. In addition, it even activates some of the fat cells that are within the skin to plump up the skin and restore its natural youthfulness.
Okay. Do they come in by name and say, you know, I want a vampire lift? Has it gotten to that point yet?
Well, the vampire lift is a catchy name.
Okay.
And you know, in a sense, it doesn't do it justice. In a sense, it directs some attention to platelet-rich plasma and the combination of hyaluronic acid and platelet-rich plasma. But there are other combinations that are called the vampire laser lift, which is what we're talking about with the Equinox CO2 laser. Their color changes, you know, with the vampire lift, with the smooth cool laser that has the high energy and cools everything down.
Okay.
You know, so that you can really have less pain for hair removal or skin color changes and textures. And then there's the vampire thermal lift, which involves a radio frequency device called EndyMed, which can tighten the facial skin as well.
So what about jowls and you know, sagging face there, or even neck a little bit?
Well, as I said, Randy, nothing beats a facelift. I mean, that's the gold standard. However, you can really improve jowls and sagging skin a lot with the vampire thermal lift. And what we do there is we take a radio frequency device that very gently, and it feels like a warm massage, it's not painful at all,
Okay.
puts a little heat energy underneath the skin, and then we add the platelet-rich plasma to secrete the growth factors.
Inject it?
Yeah, we inject it with that because that doesn't cause any holes or anything in there. And that's done with a tiny little mesotherapy needle and a special device called a mesotherapy gun. I know that's getting a little technical, but you know, that's all part of the package of the whole thing. And you know, you can even reshape sometimes belly problems that occur with liposuction abnormalities.
I've seen your photos. I mean, they're impressive. For people with bumps and lumps on their stomach, to help smooth that out.
Yeah, it can even be used for cellulite, although the things that we're talking about are off-label.
Okay.
But still, it can be used for cellulite, it can be used for body fat reduction, it's commonly used for tightening the skin. So the combination of that with the platelet-rich plasma really makes a difference that we couldn't get to before.
Now, when you have a patient that goes to you 40 plus, 50 plus, are you always using a little bit of radio frequency, a little bit of fractionated laser, and a little bit of PRP with those patients? I mean, is it always kind of that combination for many?
I think the most common thing initially is people coming in looking for a little bit of filling. They have a sagging cheek here with what we call a tear trough down there, and they'd like to add some volume. We found that if we put fat in, or even fat with stem cells in it, that can make it look too plump. And my patients all want a very natural look, as you know.
Okay.
So by putting the platelet-rich plasma in, along with some of these other things, but along with the hyaluronic acid, you can fill things in and get a really nice natural look. It can also be, we've had 2 reports now where it's also very helpful around the eyes for eye wrinkles and things like that. So then we move on to the next thing. If somebody's really sun damaged or has a lot of brown and red spots and all of that, then using that fractionated CO2 laser that we're talking about, the Equinox, and then going ahead and spreading the platelet-rich plasma on can really be helpful for regenerating that sun-damaged skin. And a lot of people are sun damaged here in California.
Now, your website, for people just tuning in, we're talking to Dr. Greg Keller. He heads up the UCLA program, the Fellowship for Facial Plastic Surgery. Is that correct?
That's true.
So you, and also, I mean, you pioneered or were the first guy to perform the endoscopic brow lift. Is that right?
I was. I have the original patents back when you could do procedure patents.
So you invented the endoscopic brow lift?
I did. I mean, I have documented patents for that, I guess.
Okay.
And we have a text on it as well.
Now, early on, because people know you, but I'm trying not to endorse you. You know, when you come on my program, we try not to endorse the doctors. But I say, look, you know, in the world of face lifting, minimally invasive facial rejuvenation, you've got to look at their work. You're a guy your website is loaded with photo after photo after photo of great results. And obviously you're putting your best work on there, but still, they're great results.
Yeah, you know, Randy,
I've met some of your patients.
you know, Randy, great results are one thing, but what I like is a person who looks younger naturally.
Okay, okay.
And that's not what everybody wants. So what we do is a natural type of rejuvenation, whether that's with, you know, the vampire lifts, whether it's with lasers, whether it's with smooth cools, whether it's with a facelift. Sometimes they'll have a little Botox that they utilize. The stem cell cream is wonderful that way.
You've got some secret stem cell cream over there. Is that right?
We do.
I keep saying I'm going to order, but I looked at your skin. I know your age. You look great for your age. So you have this special stem cell cream.
It is. It's done by a company actually in Carlsbad, where you're located.
Okay.
And they're a stem cell company. They're not a cosmetic company per se, but what they've done is they've taken human stem cells that are not fertilized, and I know that sounds odd. They're called parthenogenic, which is a big word, and we don't need to go into that now.
Okay.
But they take it apart and take all of the growth factors and peptides and everything out there that cause youthening of the skin, and they put it in a little nanosome from Japan. And that's a very technically difficult thing. And the reason they do that is so that if they dump all of this sauce in there, and you do put a preservative so a woman can carry it around in her purse and so forth, it would destroy a lot of it. But with this nanosome, it both penetrates the skin and it rejuvenates it, but it also preserves everything that you need. And it's very unique in that.
So almost all of your patients, you recommend that they get this? They're at your office?
Well, what we do is we look at a program for people. What do you want to do? And often what we'd like to do is set the patient back in age and then maintain them that way.
What are your thoughts? When I talk to a plastic surgeon somewhere across the country and they say, Randy, we just cut and sew. Because I say, do you have lasers? We just cut and sew. When you hear that with your ears, what are your thoughts on that? Do you think that's old school? I mean, do you think that's completely underserving the patients by not having that even there in the office?
Well, I think that everybody does what they feel comfortable and great with. Granted, that's probably the gold standard, and you're going to get a great result that way, particularly in good experienced hands.
But you could practice that way.
But those people who don't want that are going to go see somebody else who does.
Okay.
And that's okay. But, if you have a hammer, everything looks like a nail. So we like to have a lot of options to fit each individual person.
But see, when I hear that, okay, and maybe you're trying to be politically correct here, but I feel like if all you're doing is surgery, the skin, if you don't take care of the skin, if it doesn't look great, if it's got brown spots and red spots, you taught me this stuff sometime, just from our interviews in the past, that you're not taking care of the whole person. So does one always go with, is the modern facelift always in combination with these other things, in your view?
Okay, well, that's a good question, because there's an old saying that if you ask 2 doctors, you get 4 opinions.
Okay.
So I'll give you my opinion.
But I'm asking you, right?
Yeah,
okay.
My opinion's my opinion. And I like to take a look at one area, in this case, we're looking at the face and talking about that.
Yeah.
And okay, we need to take care of the sags, we need to fill things out that need filling, and we need to take care of the skin quality and texture. And that's the way I look at a patient. And each person needs something different. So we have a lot of tools to fulfill that goal.
And you have a celebrity clientele over the years?
We've operated on numbers of people who are very well known, no question. But I don't like to look at whether they're well known or not. I like to take a look at each person as if they walked into my office and they have a need, there's something about themselves they don't like, and if I can help them do something about it, I feel very good.
Do you ever get excited? Somebody walks in, you've done enough of these, right? 1,000 plus thousands, where you look at them and go, oh boy, this is going to be good. If they let me do my thing, this is going to be good. Does that happen?
Yeah, you can see people walking in who are home runs. I think we hit triples generally, and then every now and then you'll have a home run, and of course that feels very good. You've made somebody feel
like
great.
That woman right there. And you have a lot of facelift photos from the front, from the side, that look good, and that's a home run. That's considered a home run.
She is. This is my poster child, I have to admit.
Okay, yeah, I mean, because at 74 years old, she looks fantastic.
Yeah.
So I guess there's two people that would be interested in this kind of a program, and we're trying to educate today. You know, we didn't pre-plan this. The people that want to avoid surgery or have nothing, they haven't anything done. PRP, radio frequency, some of the other technologies, okay, for tightening and volume. And then there's the facelift crowd, and they're concerned with maintenance. Is that right? Is that what?
Yeah,
are
and
those the categories?
even the younger group of people now are preventative patients. They want to prevent some of the
28
aging.
and 30, should they get PRP or this platelet-rich plasma?
I think a lot of them should start on different creams that help maintain their look, and we talked about one of them that's very helpful.
The stem cell cream?
Yeah, should they do facelifts and light peels and things like that? We're seeing more and more people who want to do the preventative type of treatments and keep themselves as young looking as long as possible.
And you didn't see that 20 years ago, 25 years ago?
Not really. What we saw were people with a problem that wanted it solved. And
Okay.
Yeah.
Like they didn't like their neck or they didn't like their nose.
Yeah.
And so now it's about just looking phenomenal for their age.
Yeah, and we have good tools. For instance,
Now your wife, by the way, I should mention, am I allowed to say that? She almost looks half her age, right? I mean, she does. She looks phenomenal. I always see surgeons' wives, and sometimes it's obvious, but your wife is just an absolute natural beauty.
she hates it when I show her pictures, so we won't do that here definitely.
She's on your website, I think,
I know,
right?
I know she is.
Right?
She actually wanted to do this, and it was very interesting because she was the shoemaker's child. She got put off if somebody who wanted to come in and was a paying customer
Yeah.
showed up. So she put herself on under an assumed name, and
Okay.
you know, that's what happened.
But nobody would ever guess she had anything done. You wouldn't even guess she had a filler done. I mean, it is natural across the board from every angle.
That's what we like to do. We really like to do a natural type. And that's my own taste. And I'm not saying it's right or wrong, don't get me wrong, but natural type of rejuvenation of the face, I think, is important
Okay.
in my mind. But that's my taste.
So
Not
the
everyone
hot,
has
so
that.
the hot thing right now, we are out of time, is you say stimulate your body to make yourself look younger by using. So let's go over that recap.
Okay, well, basically, a lot of what we're doing with the non-invasive type of things is tricking your own body into making itself younger. And this is where everything's going. We're cell-to-cell signaling, where we're signaling your cells by putting in heat, by putting in light, by putting in platelet-rich plasma, into thinking that it can rejuvenate itself, which it can do to a great extent, is where the whole field's going. I'd like to look at it 10 years from now because we've seen tremendous improvement even over a short period of time.
Interesting, interesting.
Yeah.
You know, I had a guy, I didn't tell you this either, and I'm filled with compliments today. Newport Beach guy. He goes, I'd love that, because I told my son, who goes to school in Santa Barbara, or Ventura, I should say, film school, and and the plastic surgeon said, I'd love to go to Santa Barbara, but there's no way I could compete with Greg Keller. That means he can't even move to Santa Barbara as a plastic surgeon because you're there. He says, you can't compete with that guy.
That's not true.
So good for you. Well, no, that's what he said.
I have a
though.
lot of very good colleagues in Santa Barbara, and they're great, and they have
But
very
that's a
busy
compliment,
practices.
though, from a colleague.
I know.
It's very nice.
I appreciate
actually.
it. It was very nice of him. Yeah.
So the new trend then is
Make your body, make yourself younger, and do it with your own stuff as much as possible.
with
'cause
stem cells and
Yeah, a lot of this, by using your platelet-rich plasma and some of the other things, you can't hurt yourself, really. You know, you can't get HIV from your own plasma unless you have it already. You can't get a lot of things. It's very safe. It's predictable.
Okay.
You're not going to get lumps and bumps. It's terrific.
Now, we should also mention that pricing. I mean, you know, you're about in line with what's going on across the country.
We are. We want to keep our pricing fair, but at the same time, we want to charge enough so we can do the best possible job and use the best possible equipment. So we're not the least expensive, and sometimes you get what you pay for.
Okay.
But there's a certain limit to that, and we'd like to be fair and charge what's fair to people, but yet we want to charge enough to do a great job on them.
Okay. If somebody were to ask you, why is it? Because and people, I challenge people to go to your website, look at your results, especially your facelifting results, okay? If somebody were to ask you, behind the scenes, why is it you get better results than most guys with the face?
I don't think I get better. I think I get results that I'm happier with. And again, if
So there you go. You're always positive, Dr. Keller.
well,
Good for you.
I am. No, I really mean that sincerely and believe that. I think that we like to think that what we do attracts patients, but really patients know what we do and they come to us for that reason. They select us, not the other way around. And so some people like to be pulled tight. Some people like a different look, a contoured look. We like to put people back. I'm not concerned with getting rid of every single wrinkle. I want to make people look younger and natural.
Okay, good. Now, if you were able to do your own facelift, you would do it. Is that right? I think you told me that one time.
Well, the good thing is...
You said if I could find somebody good enough, I would do it. I think you told me that.
No, I was ready to do it. And, you know, I have 15, soon to be 17 fellows out there that I've trained. So I think I'm covered.
Okay, all right. Okay, well, thank you for coming on the show.
Thanks
Very
again,
good,
Randy,
very good.
for having me.
So go on your website, take a look at the before and afters, non-invasive, minimally invasive. If that's what they're looking for, they can call your office. They still get to see you on the consult. Consults are free, by the way?
Consults are free. I don't feel justified in talking to somebody. You know, I like to make sure that they understand communication is 2/3 of what we do, really.
Okay. Okay, good for you. Thanks a lot. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website and just put in Dr. Keller and it'll say non-invasive. For now, I wish you good health.